Hi class, this is Dr. Shahada, and in this video I'll be reviewing with you Chapter 3, which talks about the evolution of health services in the U.S. Now, in this week's module, you will have an attachment, a PowerPoint presentation attachment that you can download. So along with reading the chapter, you should be also going through the PowerPoint presentation. I will be touching on a couple of the topics covered in the PowerPoint presentation, but you are responsible to go through everything. Okay, I do want to point that out, but I will touch on a couple of things, as well as a file here. As you see, it's a file titled Terminology for Chapter 3, and this includes all the terms and their definitions from the chapter. So what I'm going to be doing now is I'm going to go through some of the areas of, or going over the information found in the Some Info from the chapter section. And I'll also be jumping to the PowerPoint slides. So as you can see here, we have a table on that shows you kind of that evolution medicine went through in relation to the impact of the development of science and technology. So advancements in science and technology was one of the reasons for that increase of demand of medical services. So you need to keep in mind that in the early 1700s, with this specific table, we're starting here at the mid-18th, but in the textbook, you actually start around 1460 and on, but they really focus on the mid-1700s, looking at the area of medicine. And what you'll notice is that, medicine was more of a trade, okay? It was an unorganized profession, and then you see it evolve into what it is today. So there were a number of things in the area of science and technology that impacted that. One of them is really the advances in the area of medicine, advances in bacteriology, antiseptic surgery, anesthesia, immunology, diagnostic techniques, and even new drugs that gave medicine a new aura of legitimacy and complexity. Scientific medicine and technology increased people's reliance on physicians' professional judgment, because you need to remember that in the first column you see here, at that time, people were more reliant on themselves, on home remedies, on looking to family for care. People weren't necessarily seeking out physician services. And of course, the training to become a physician was not an organized, it was very unorganized. It was an apprenticeship. So there was a lot of factors going on there. But, when you have that cultural shift of when people start valuing the judgment of a physician, because they look at how their diagnosis is based on scientific knowledge, that's a very important shift. Another important factor is that lay people were no longer competent to provide medical care. Professional help was likely to do more for the patient than the folk remedies could do. So, before you would go to a barber and they were looked at as a surgeon, and they would do bloodletting and all these different primitive procedures. But as time went on, the area of medicine evolved, and science and technology were two very important factors. All right, so now I'm going to scroll a little further down. Okay. And now we're going to be talking about the 5 main factors to explain why the medical profession remained largely an insignificant trade in pre-industrial America. So what I'm going to do now is I'm going to switch over to the PowerPoint slides, since there are a number of slides that touch on this topic. Okay. All right. So here we are at the slide to look into the factors of why the medical profession remained an insignificant profession. Medical practice was in disarray. It was unorganized. The medical procedures were very primitive. So in the following slides, we're going to be going through some of those things. And what I mean by primitive medical procedures is an example would be bloodletting, when they would try to withdraw blood, hoping that would help the body to heal. An institutional core was missing. So when we say this, I mean the institutions fulfilled a charity and welfare when it came to hospitals, rather than a healthcare function. So these precursors to hospitals were almshouses and pest houses. And then we had dispensaries, which were somewhat similar to a hospital, but still they were for outpatient services, and they were used for apprenticeship and experimentation. There was also state-run asylums and a few voluntary hospitals, and that was really going towards, the very early 1800s, but they lacked sanitation, ventilation, and trained nurses. Then we had the unstable demand for medical services. Again, as I mentioned before, it was family-based care. People relied on themselves. And when they looked at physician services, they found it expensive. Travel time was very expensive. And they felt like there was limited benefit for the medical treatment. Medical education was substandard. Training was through apprenticeships under poorly trained preceptors. Later on, schools were started by physicians where they would have no admission requirement, general studies, little training in biological sciences, no laboratories or clinical observation. All right, so here is, again, early practice of medicine. It was a trade. There were no rigorous study, as I mentioned earlier. Usually it was clergymen that combined medical services and religious duties. You also had midwives, homeopaths, and naturalists that can practice medicine without restriction. So this is where the American Medical Association comes into play in 1847 when it was created. And the premise was to create these barriers between traditional practitioners and the irregulars. Because at the time, anyone could practice medicine. Medical procedures were primitive. And again, no rigorous course of study. And working in the area of medicine, it was looked at as low status, often a side job for extra income. And again, most families preferred being self-reliant, couldn't afford physician fees, and felt like even, the travel time, a lot of times there was a lot of travel to get to a physician, wasn't worth it. Now, some examples of people working in the area of medicine. A barber sells herbal prescriptions in his shop. So earlier in this PowerPoint presentation, we do touch on the barber. They were looked at as surgeons. Next, a woman giving birth at home with the help of her sisters and mother. A tailor who doubles as a doctor visits the home of a boy, and boy who happens to have a cut, and he would sew up the wound. And a church pools its funds to have a doctor visit its pastor who has been bedridden with a mysterious illness. The doctor bleeds him and gives him herbal concoctions and enemas. The theory of intake and outgo was explained for all diseases, and that's why they did the bloodletting, and the use of enemas and such is based on this theory that, something entered the body, we need to get it out of the body. And physicians relied on their 5 senses. Now I am going to jump to the missing institutional core slide. And I just want to briefly touch on the differences between the US in pre-industrial era and in Europe, because we were actually lagging behind a lot in the area of medicine. All right, so let me go to that slide. All right, so here we are. Now, advances in medical science, experimental research, and medical education in the US lagged far behind advances taking place in Europe, notably in Britain, France, and Germany. Now, I'm sure Germany kind of sticks out there because Germany actually had one of the best healthcare systems. So a lot of healthcare systems that were implemented in other European countries were modeled following their healthcare system. Now, a major reason for this lagging behind has to do with the differences in professionalization of medicine between Western Europe and the US. Cultural and attitudinal barriers delayed the assimilation into American medicine of the developments in American medicine from occurring in comparison to Europe, because American attitudes about medical treatment placed a strong emphasis on natural history and on conservative common sense. So that cultural shift was needed in order, that acceptance of physicians, their diagnosis, their suggestions, and that wasn't there yet in comparison to Western Europe. So let's look at a couple of things we have listed here. The US, there were no widespread hospitals built before 1880s. Okay, while in Europe, general hospital expansion had already been going on since the early 1800s. American hospitals played a small part in medical practice. Again, they were more used for housing the poor. So it was more social welfare by taking care of the poor, those without families, those away from home for travel. While in Europe, the medical profession was associated with hospitals. New advances in medical science were adopted in hospitals, and the medical profession was very highly regarded in close association with the scientifically advanced establishment. Okay. So let's go to the next slide here. So almshouses. So this is one of the precursors to a hospital. Here is actually a picture of an almshouse from Britain. And it's really a shelter for the poor offered by the local government. Primary function, social welfare, again, food, housing. Healthcare was a secondary role. We also had pest houses. Here's another example of a pest house, which was operated by the local government, served primarily for quarantine of contagious diseases. So they would quarantine examples of the type of diseases: cholera, typhoid, smallpox. We also had dispensaries. They started in Philadelphia in 1786. Private institutions, they were financed by charitable contributions and voluntary subscriptions. They provided basic medical care and dispensed drugs to ambulatory patients. They actually began with apprenticeships at the time. So this was not the actual education for medicine, was not standard yet. All right, so early hospitals, again, began 1850s, 1880s, and they lacked resources. They had deplorable conditions, poor sanitation, inadequate ventilation, and unhygienic practices. So the mortality rate, both in the US and the European hospitals in the 1870s, was 74%. So the idea was people wanted to avoid hospitals unless absolutely forced to be there, because they viewed it as a place where people pass away. Now, again, regarding unstable demand, which I touched on briefly earlier, professional services suffered low demand. Medical care was provided, again, not by physicians, many folk remedies, and family-based care. High costs for professional medical care led to low demand. So people looked at that. It's not worth it to them. Transportation was costly. The actual service, the healthcare service by the physician, was costly, and there was a limited benefit to the medical treatment. That's how it was viewed. So private practice and fee-for-service became embedded in the American medical care. So the next couple of slides, medical training will be discussed, how it went from substandard and the steps to becoming more of a standardized study. I'm going to be jumping now to the topic of the transformation of medicine in the US. Okay? All right, so this is slide 34, transformation of medicine in the US. So there are a number of factors that contributed to this transformation. Let me go back one slide to slide 33 where it actually lists them. So key contributors, what we're going to be going through now. Urbanization, science and technology, institutionalization, dependency, cohesiveness, and organization, and educational reform. All right, so looking at urbanization. So people were distanced from their families. They could no longer rely on family. The proximity of the physician and patients reduced that travel cost that people would think about when they would consider seeing a physician. And people were more attracted to growing cities and towns. And of course, this increased physicians' productivity because they were able to provide services to a large group of people that were in close proximity. Regarding science and technology, so the effectiveness of medicine became widely recognized because of those pioneers in medicine, milestones in medicine. There was that cultural authority aspect. So there became a general acceptance of and reliance on the judgment of the members of a profession. That was created. So that's what cultural authority. So what we mean by that is that there was that acceptance and people valuing the opinion of a physician. And that was huge. That was that cultural shift that needed to happen for medicine to really be accepted and have grown to what it is today. Society would now depend on their superior knowledge and expertise, so physicians no longer were viewed as the local barber. The growth of science and technology increased the demand for medical services from physicians, and there were a series of groundbreaking medical discoveries in the areas of bacteriology, antiseptic techniques, anesthesia, diagnostic equipment, and new drugs. So the next couple of slides will be a number of different milestones milestones in the area of medicine that we have, that were achieved. So without medical pioneers, there would be no medical advances, no technology evolution, no progress at all. So I'm not going to be going through all the slides, but I do want to touch on this one, and I think the following one. So the theories of conclusions of medical pioneers, they're not always popular. New and different ideas are often met with hostility, distrust, and contempt. And I'm sure you guys are not surprised by hearing that. We've seen that not only in the area of medicine, but in so many areas. And then we have medical pioneers. They often deal with opposition and conflict, but they move forward with determination. So here are three, and then I go through a number of others. First, Alexander Fleming, story of penicillin, very important one, and a very big contributor to advancing the area of medicine. There was also Louis Pasteur, who demonstrated sterilization techniques and credited for the germ theory of disease and microbiology. Joseph Lister, aseptic technique in surgery. And you just think of when these, advancements or these discoveries were made, how much it impacted our world. I mean, you look at penicillin used every day. You think, you have an ear infection. First thing you go to is an antibiotic. If you're not allergic to penicillin, that's always the first route of treatment. All the sterilization techniques, such an important thing in our time now. So it's interesting to see that, when these advancements came about, how important they were. All right, so let me see what the next topic we're going to be addressing here is. We're still on topic of transformation of medicine, but the next one we're going to be talking about is institutionalization. So modern hospitals provided an institutional core. Urbanization was a contributor to the institutionalization of the medical profession. Physicians and hospitals developed a symbiotic relationships. Hospitals expanded. Of course, medical technology, professionalization, and urbanization also were contributors to this institutionalization. Hospitals had to depend on physicians to admit patients, so that again contributed to that symbiotic relationship. And hospitals became indispensable for medical practice due to advances in anesthesia and surgery, which created that demand for hospital services. Okay, I already covered what is being presented in this slide. Next one, dependency. So patients depend on medical professions, judgment, and assistance. So the society's expectations of the sick to seek medical care and get well increased. Physicians no longer were seen as tradesmen who you visit for a quick remedy. Cultural authority of physicians increased, right? Which enhanced the role of physicians. Then we have that autonomy and organization, or cohesiveness and organization. So social and economic changes led to greater cohesiveness among medical professionals. Standardized education created a common core of knowledge among physicians. There was specialization, education, reform, and professionalization led to the need for patient referrals between physicians. They're working together. U.S. physicians remained independent of hospitals and corporations. So corporate practice doctrine was imposed by many courts. American Medical Association gained control over medical practice, licensing, and education. And an example of this would be licensing was contingent on graduation from an AMA-approved school. Okay, so we just touched on that. So greater cohesiveness when I spoke about the specialization, educational reform, and professionalization. and it became more of an organized medicine. We touched on the role of the AMA. And next, licensing. So physician licensing and educational reform developed simultaneously. 1870s, medical licensure in the U.S. became a function of the states. By 1896, 26 states enacted medical licensure laws. Both licensure and upgrading medical school standards, physicians obtained a clear monopoly on the practice of medicine. And of course, it became illegal to practice without a license. Okay. And then we had educational reform. So reform began around 1870, affiliation of medical schools with universities. Charles Eliot revolutionized the system of medical education. We have Harvard and Johns Hopkins who took the lead when it came to medical education. Johns Hopkins was the first medical school in 1893. It was also the first school of public health as well. Just wanted to throw that in there. Medical education became a graduate training course requiring a college degree. There was a model and standards that were put in place. And laboratory instruction and science were added to the curriculum, which strengthened faculty, added teaching hospitals. And proprietary schools closed that did not comply with this educational reform, with the standards that were being put in place. Now, one important contributor to this educational reform was the Flexner Report. So AMA hires the Carnegie Foundation to study the state of medical education in America. This was in 1910. Findings were widely accepted by the public and by the medical profession. Higher standards were proposed, strict entrance requirements, and better facilities. The Flexner Report forced proprietary schools to close. State laws passed which required graduation from AMA accredited medical schools, and increased educational requirements, improved quality of practice, and enhanced cultural authority. Now, I do want to touch on the development of public health, which we will be doing next. So, urbanization increased concerns about protecting the health of populations as deadly outbreaks of communicable diseases became common. Most states created public health departments by the start of the 20th century. Urban centers led to the growth of these unsanitary living conditions, inadequate methods of sewage and garbage disposal, limited access to clean water, long work hours, and unsafe industries. So some of the epidemics that were coming about were yellow fever, typhoid, cholera, smallpox. And I had found this poster that touches on the topic of quarantine from 1902, which I thought was very interesting. I wanted to share with you guys. All right, so in this slide, we're touching on the same topic. Lemuel Shattuck, which we had touched on in the last chapter, in chapter 2, very briefly, outlined the blueprint for the development of the public health system in Massachusetts in 1850. So widespread public health decreased the spread of infection, reduced mortality, increased life expectancy.